Hello, and welcome to iMD in Action, a series of short video tutorials that show you just how easy it is to use the iMD platform to engage with and educate your patients so that they leave your pharmacy feeling well supported and ready to take charge of their health. Best of all, you can achieve this all in a few short minutes, and all you need to get started is an internet-connected device. I'm Ashley Nightingale, Content Manager at iMD Health, and the scenario we will look at today is using iMD to provide an osteoporosis patient with educational support materials.
Now let's get started with the second demo on osteoporosis. Jane, who is a frequent customer of yours, was recently diagnosed with osteoporosis. She just left her physician's office, who gave her a prescription and told her the pharmacist would explain what the disease is. Now this is where iMD comes to life. You can now provide educational materials on the disease and help prep Jane on how to manage her new diagnosis. So let's get started. Again, we collect the patient's gender and age and email so she can receive her consultation summary after her visit to the pharmacy. Once you've collected this information, let's begin to educate Jane. The first thing we need to do is find the topic we're going to talk about. On my shortcuts, I have osteoporosis here. This is the topic I frequently educate patients on. I can also find the disease state by looking in the search bar. Once I get to the disease state, what you'll see is a variety of images, documents on understanding the disease, lifestyle tips, and treatment options. This image here is showing you the difference between a normal bone and an osteoporotic bone. Osteoporosis means porous bone. This is a decrease in which the density and the quality of the bone are reduced. As bones become porous and fragile, the risk of fracture is greatly increased. The loss of bone occurs silently and progressively. The good news is you can help manage the disease. I'm going to send Jane a few brochures about osteoporosis and healthy lifestyle tips, including exercise and nutritional information. The first brochure I'm going to send her is Living Well with Osteoporosis. This is from the Osteoporosis Society. The next thing I'm going to send her is information on lifestyle. I'm going to send Jane information on nutrition for her to read, as well as exercise tips. It's really important to exercise 2 to 3 times a week. This will increase your bone density and decrease your risk of fractures. This guide will give you examples of the different exercises you can do and the proper way to do them. Take your time when you get home to read all of this information I'm sending you, and please call if you have any questions. This was a quick overview of osteoporosis, and we equipped the patient, Jane, with educational materials rather than just talking about the disease state, which Jane may not have been able to process all of that information. When a patient does not understand their disease, they tend to go to Dr. Google and generally diagnose themselves with additional disease states. We want to eliminate that, and this is why iMD is a valuable tool for you and your patient.